First, hospital mega mergers and fights between doctors and healthcare systems. What's happening and how does it trickle down to you, the patient? Good evening and welcome. Tonight, a very unique battle for your business in an area where most of the time we don't think of ourselves as a customer. We're not talking about buying a new car or clothes or groceries. We're talking about your wellness and who you want to see when you need a family doctor, an MRI, an anesthetic before surgery. Yes, there is fierce competition going on for your business, and it's leading to big changes and very public brawls between healthcare systems and doctors. We're on your side tonight asking, what does it mean for you? Now let's start with the big headline in our area. You'll remember back in February, Carolina's healthcare became Atrium Health. It said it wanted to change its name because it wanted a name that didn't limit its geographical area, the Carolinas. Made a lot more sense when another announcement came the very next day. Carolina's healthcare, now known as Atrium, was merging with a Georgia-based healthcare system, Navicent Health. Right now, Atrium is the biggest healthcare system in the state, and this concept of expanding healthcare groups isn't unique to the Charlotte area. Just look across the country. Mega mergers are happening in Illinois and Wisconsin, Colorado, California, and also throughout New England. So why are they doing this? Well, hospital leaders say bigger gives them more bargaining power when it comes to dealing with insurers to bring you health care for less money. They say it also makes it easier for you to get care because they're more accessible. And they say you'll get better quality care because when a smaller hospital merges with a bigger one, it gets you more access to advanced technologies. But of course, there are arguments against this as well. Economists say large hospital systems can ask insurance companies to cover more of the cost for procedures, but that cost often just gets passed on to you, the patient, in your insurance premiums. And some doctors here are also arguing that the actual quality of the care and the options you have are reduced. In fact, 92 doctors from Mecklenburg Medical Group are suing Atrium. They want to operate independently. Deon Roberts from the Charlotte Observer has done some really good reporting on this fight, and we asked him to stop by and talk us through what these doctors are claiming.
They say that they can't refer patients to other providers, that they have to refer patients only to Atrium facilities. And they feel that in some instances it may be more affordable to send them elsewhere, and they want to do what's best for their patients. So that's one reason. Another reason is new employment agreements that apparently were presented to them last year by Atrium. Were going to cut their compensation, and they said that is a non-starter. They didn't want to do that. And also it would have widened the radius that covered where they could not practice in Mecklenburg County and the region if they were ever terminated by Atrium.
Atrium's reaction to this has been, well, complicated, I think would be a word for it, wouldn't it be?
Yeah, I'd say so, because Atrium on the one hand has said, look, we're going to grant you this request to go ahead and break away and operate independently. But Atrium has also said, but we don't want you to go. You know, they've said that in memos to them. So it is interesting. I think Atrium does want to see these doctors stay. At least that's what they're saying publicly. But the doctors, at least 92 of them, don't want to stay.
And these MMG practices are in some neighborhoods where certainly Atrium would want to be, from Huntersville down through South Park into South Charlotte, right? And
these doctors have been with the system for a long time, and the group has been around for a very long time as well. It's probably one of the better known physician practices owned by Atrium.
Now, we also spoke with healthcare expert Seth Denson. He says doctors around the country are taking similar action when their companies merge. But money talks.
When we start to follow the money trail, the amount of investment that these larger hospital systems can put into the marketplace to silence, so to speak, these voices of resistance is significant.
The MMG doctors are claiming Atrium is reassigning their patients to new physicians to avoid losing their business if these doctors, in the end, leave the system. And just yesterday, Deon Roberts reported Atrium is now awarding some MMG employees bonuses of up to 10% to keep them around at least through the end of the year. Denson says having those doctors around is critical for Atrium.
The other battle is with Southeast Anesthesia Consultants. This is a different fight, though. What's happening here?
Well, this is different, first of all, in that these doctors don't want to lose their contract with Atrium. They want to stay with the system, whereas the Mecklenburg Medical Group doctors are trying to break away. This is a situation where the contract expired between the anesthesiologist and Atrium. This contract has been in place for almost 4 decades. So these anesthesiologists have been serving Atrium facilities for a long time, and it's the majority of Atrium's Charlotte area hospitals. But Atrium said, you know, we tried to put in some new procedures that would have lowered costs for patients and also improved safety, and Southeast anesthesiology consultants did not want to agree to those terms. Now, Southeast has a different take on this, which is that we shared confidential information with a consultant last year who was looking at the anesthesiology practice of Atrium, and that consultant then went and used that information to start a competing firm that now has a contract with Atrium.
So they're saying we were sharing information. You brought in this person who we thought was just consulting, looking for ways to streamline, improve the practice, and then they end up getting the business?
And that's what happened, and that provider takes over July 1st.
All right, so what now? Well, the spat has certainly gone public. A Twitter account representing that anesthesiology practice has been slamming Atrium. It's encouraging people to send emails and sign a petition. Dion says other local practices are probably keeping a close eye on all this, and depending on what happens, they may also try to break away. It's certainly a lot for you, the patient, to consider.
You have to sort of take everyone's different points of view and sort of weigh them as best you can. I mean, you know, the doctors who want to break away say that, you know, Atrium has monopolistic practices and is not necessarily doing the best thing for the patient, and that's why they want to go off on their own so they can spend more than 15 minutes at a time with patients. And Atrium says, well, you know, we're doing the best we can to serve our patients, and we use best practices, and so it really is, I'm sorry to say, just sort of he said, she said.
Yeah.
We want to know what you think about all this. You can send us your thoughts or questions to AskJamie@WBTV.com.